Hello, Dr. Vikki Petersen here. I was looking over my Facebook group, Hiatal Hernia Solutions, and there's a lot of questions, which of course I'm not surprised because we literally hear from people all over the world with this problem. So it is close to an epidemic, I would say, in that there's so many different facets of it. It's so misdiagnosed, underdiagnosed, and of course one of the common questions that is asked is, what do I take? You know, what drug do I take? Or even a natural solution, what vitamin can I take? And of course it's normal, especially in our medical model, to look for the one fix, right? I've got this, what do I do for it as a single entity? And that's not the answer. So I want to go into why what we do is different, and why just the drug is not going to really do what you want it to do. So let's look at the two most common medications that people with hiatal hernia are offered. The most common is antacids of various types. There's a lot of different antacids. And of course this comes from the fact that one of the predominant symptoms associated with hiatal hernia is that the stomach is squeezing and inappropriately shooting the acid that should be residing in the stomach up the esophagus, so you have heartburn or acid reflux, and it can be pretty miserable. There's no two ways about that. You can get a hoarse voice, it can mimic chest pain, it can mimic a heart attack and interrupt sleep. So, you know, this is something that will get your attention. And the conventional medicine model is, there's acid in your esophagus, that's inappropriate, let's put you on an antacid. On the face of it, that can make sense. However, it's a terrible idea. So, why? Your stomach is really your first area in which digestion takes place. So you chew your food, but then it just goes down the tube called the esophagus, and it gets into the stomach, which is literally a bag of acid. It's designed to be that because it requires that hydrochloric acid to break down the food. Now, as soon as you're put on an antacid, you have squelched the ability of the stomach to do that first step of digestion. So from the get-go, as soon as you're doing that, you have maldigestion, malabsorption, because it's an interesting sort of cascade that occurs in the digestive tract, which is that when the broken down food leaves the stomach in a normal digestive process, then it's of a size that's being broken down by that acid, and now the enzymes in your small intestine and bile from your liver and gallbladder get to work, and it's all predicated upon step one has to occur properly before step two, before step three. So as soon as you're on that antacid, step one doesn't occur, and there's just really no way for proper digestion to then occur, which sets you up for a whole cascade of problems of malabsorption, maldigestion. You're not absorbing your nutrients. So that is a problem. There's also some dangerous side effects associated with long-term antacids, and I'm not going to go into that right now, but suffice to say, you're not supposed to be on them for any length of time because of known dangerous side effects. So there's that. Now, if you're someone whose hiatal hernia has given you anxiety, things like heart palpitations, you feel anxious, okay, which is a very common symptom, then that anxiety, as soon as they figure out, and if you've had this for a while, you've undoubtedly visited an ER, and to make sure that you're not having a heart attack, or the anxiety or panic attack can be very overwhelming. They love to occur in the middle of the night, which is of course even more scary. And what you're told after an evaluation is it's just a panic attack. and then you're given a dangerous psychiatric drug, an anti-anxiety, antidepressive drug. So the problem with those is, again, very known dangerous side effects of having suicidal tendencies, suicidal thoughts. These are not innocuous drugs by any stretch of the imagination. So there are your two drug options, neither of which, A, is going to correct the problem, and they're going to create more problems. So what do I take when it comes to conventional medicine? There are no good options really that are being offered to you. If you have a very severe hiatal hernia, where we're talking about a great deal of the stomach is above your diaphragm and you're literally not digesting anything, then surgery can be an only option. And that's where things like surgery are great, you know, because they do that thing that nothing else can do. But again, that's pretty rare, and a minor or a mild hiatal hernia, it's rare that that's suggested, because what's known is that the success rate is poor. It doesn't tend to last. And then, so think why? Why does somebody stitching that hole, making it narrower, why does that not last very long? It's because you haven't gotten to the root cause of why. So that stomach's in spasm, it's pushing up, and it's slowly widening that hole again over time because you didn't get to the root of why that stomach is in spasm, why the diaphragm is too high. There's a whole combination of structural issues that need to be addressed. So what we do that's so different, and I must tell you, it started with pulling down the stomach and sort of breaking up that spasm, and patients would say, oh, that feels so much better, but it was temporary, and we hate temporary. we like fix, hence the name of our clinic, Root Cause. And so we don't want a temporary fix, we want it truly fixed. And then as we learned more and more, as we saw more and more patients, we realized that the reason the stomach's in spasm is not just about breaking the spasm, but you have to get to the why. Now, the why is a few different things. You can have foods that you're eating. Of course, what goes in the stomach? Pretty obviously food. So you can have certain foods that you're eating that are causing the stomach to get irritated, and when it spasms, it has no direction to go but up because it's attached via the esophagus. And then you can have infections. There's a variety of bacterial infections or parasitic infections in the stomach or in the gut. And unfortunately, with our food system not being as healthy as it should be, we don't have a good balance of the good guys. You talk about probiotics, the good guys versus the bad guys. We've got more bad than good, and it can create the gas and the bloating and just this imbalance of this population in the gut. And so we have to tease out, and it's not, we're not talking about 50 different options of why you got there, but it has to be through a good history, examination, evaluation. How did you get there? And it's different for different people. So, there's the person that had a lot of antibiotics either as a kid or a young adult and set themselves up for that chronic constipation that you've had for a length of time, sometimes since childhood forward, that increased intra-abdominal pressure, that comes up from the bowel being backed up, creates that pressure and everything goes upward. There's many different things that have to be assessed, but then you get to the root of that, and then the problem is handled. Now, it's so hard to understand for at least conventional medicine is some people, maybe they're used to their constipation, they've had it for a long time, and they just feel this pressure. And then they say, wow, I'm short of breath. I feel a little anxious. My heart's palpitating. Why is all this heart and quote unquote lung issues happening, right? Heart palpitations, trouble breathing. So you see a pulmonologist, you see a cardiologist, and they all throw up their hands going, you're fine. There's nothing wrong with your lungs. There's nothing wrong with your heart. And you go, well, that's nice, but this is really happening to me. And it is, and it's all secondary to that diaphragm, which is that sheet of muscle which allows air to come in and out effortlessly. It's kind of spasmed. So because it's not allowing enough air, you feel short of breath. And then there's a nervous system connection. So there's a lot of different systems that feed into this. And it's not for everyone, but if it's you, you know what I'm talking about. And so you get this anxiousness or feeling of like, I don't know why, but I'm super anxious. And it's because your nervous system is telling you to be anxious. It's actually secreting stress hormones to get your attention, to let you know there's not enough oxygen coming into the system, and I want you to do something about it. So it gives you those stress hormones just to kind of wake you up and say, do something. So that's a nice survival response that your body's, it's trying to help you, but you're feeling miserable and nobody's giving you a good answer. So to come full circle on this, the most common question is, what do you take? It's not a single thing. Actually, as I said, we have to sort of tease out what the root cause factors are for you. And it's, should I do surgery? I don't recommend it unless it's severe and there's no other option, because the success rate is poor. It doesn't tend to last because you didn't get to the root cause. And then, when you have the hiatal hernia symptoms, you have to realize there's a lot of issues with digestion and absorption, as I mentioned earlier, and that's affecting all of you. No part of your body can work correctly if it's not being fed and nourished properly, and that's what your digestive tract does. So you can see that there's such a combination of issues happening here, and the great news is, and that's what we've been developing for decades, is the cause of why it's that way for you. And the great news is, as I said, it's natural. So no drugs, no surgery. Yes, there are some lifestyle changes, but it's worth it, right? It's worth it to feel great. So I hope that answers a very common question. Give us a call. We would be delighted to really get to the root cause of this for you, because you suffering and not understanding why and not getting any help, you are not alone. But we are absolutely dedicated to helping. So give us a call. The number is 408-733-0400.